Hi, my name is Diana Huarco. My topic is renal complication of hematopoietic-cell transplantation. Definition: hematopoietic stem cell transplantation offers curative potential. Is treatment of bad malignant and non-malignant disorder of lymphomatopoiesis. Application in medicine. It has been associated with the development of bad acute and chronic kidney failure. HSCT remains a very important cause of morbidity and mortality. Peri-transplant acute renal failure is common and costly, and ARF requiring dialysis are associated with extraordinarily high mortality.
When we talk about stem cell transplant, what we're typically referring to is transplantation of the bone marrow. The bone marrow is an organ, just like your heart or your skin is an organ. The bone marrow is the organ that produces the blood, and the blood then circulates throughout the body. When a disease like leukemia hits a child, it resides in the bone marrow. And so in order to cure that disease, we have to give the child very, very high doses of chemotherapy and radiation to kill and eradicate all those cancer cells. And then we rescue the patient with healthy bone marrow from a sibling, or in some instances, from a random donor from the general population. This is the process of bone marrow transplantation, and it involves the therapeutic transfer of healthy blood stem cells from the donor to replace the diseased blood stem cells of the child.
Pros and cons. Pros. Overall improvement is outcome after hematopoietic cell transplantation. It is a great cure for lymphomatopoiesis due to its effectiveness. Cons. Kidney injury remains a common complication and contributes to the morbidity and mortality associated with the procedure. Risk factors that are only weight to patients who have undergone hematopoietic cell transplantation include acute GVHD hepatic sinusal obstruction syndrome, use of calcineurin, infection, and viral infection.
One of the improvements I can see right now immediately is there's better coloration in my face in just a few days. As far as the kidney function, I won't know until the cells do their work for a month or 2 to 3 months. but I've seen coloration and I feel good. Well, I haven't had no treatments before I come here. I went to the VA, I go to the VA medical, I'm a veteran, and they told me that my kidneys were down to 29%. And in 5–10 years, I might have to go on dialysis. So I thought I got to do something about it. And I asked the doctor there, I said, what about stem cells? She didn't know too much. She says, when the time comes, we'll look at putting you on dialysis and put you on a list for a kidney. And I didn't want that. I heard a little bit about it. I researched on the internet about it. And then I started calling. I called a few places here in Thailand. And then I got a hold of Faith, but through the internet, and she let me talk to the doctor. I talked to a couple other doctors, but when I talked to the doctor here, I can't remember his name, I'm bad at names, but he seemed very intelligent, and I'm a pretty good judge of character, and he knew what he was talking about, so I felt comfortable. This facility is phenomenal. They keep it clean, there's plenty of staff, the rooms are nice. I don't have no complaints. If I have it, there's more personal care. You know what I'm saying? More personal care. So if I had something major wrong with me, I'd rather come over here and have that problem taken care of than go to a local hospital back home where you're just another number. Everybody was professional. Everybody did a good job. So I have no complaints at all there. I'd tell him to get a hold of it and talk to Dr. Nassar. Talk to him, let him know. I had to send my blood work. I had to send everything over here before, and he studied it. And he can study your condition. And when you're spending money on yourself, you're never wasting it. Because if you let your condition go, you can't take nothing with you. It was a positive experience.
Issue applied in Ecuador. In Ecuador, this type of transplant, but kidney failure is prevalent in this case. This incidence of acute kidney injury range from 10% among all-lung transplant recipients for nearly 50% among patients receiving allogeneic transplant. Conclusion: acute renal failure is a common complication after hematopoietic-cell transplantation that occurs in the first 3 months after transplantation and increases the risk of mortality and future chronic renal failure. There is no specific treatment for VEOH, but it is management of fluid overload, kidney dysfunction, and other complications. Thank you very much.